no. Oh.
Okay. Talk me through that one.
It's Wilson from Castaway with Tom Hanks, where he's on that desert island. Because I don't mind being compared to Tom Hanks. Problem is, it's always when when he's been Forrest Gump. That was my first comparison to Tom Hanks, because I used to have not that I've got short hair now, but short hair, and people used to say, "Run, Forrest, run," which ended up in an accident one time. It was a surprise birthday party for me that I got so inebriated before we went to the birthday party that it was at a house in Sullyoak at Tiverton Road.
Oh, I used to live on Tiverton Road.
Good old Pete Casey.
Yeah. Good old Pete, yeah.
Pete Casey was kind of looking after me and managed to prize me out the pub, because I got really annoyed that all my friends had left the pub, but they'd gone to this surprise party, and I was getting more and more annoyed and getting more and more upset. Pete goes, "I'll stay with you." And then the only way he could coax me out of this pub, because I was prepared to stay there on my own, was with a Dolmio. So
he's walking up the road, kind of like, and you were just following it.
He just said, "I'll take you back to our house. I'll cook you a Dolmio, and then we'll go for a few beers down the pub." So I thought, "Oh, fair play." So anyway, we ended up at our place, and there was all these banners up saying "Happy Birthday," and one of the other lads' birthday is about a week before mine, who lived in the house. But I just thought, well, there's a lot of people here. And there were like canopies and,
no way,
all this sort of stuff. And it was just a wonderful little spread and birthday cake and loads of people in this house. I thought, he's got a lot of people around your house. And then after about half an hour, one of the guys came up to me and he went, "You do realise this is your surprise birthday party?" And I was like, "What?" So it was, I probably thought I was ungrateful for a good 30 minutes or so. And so.
That was very nice. What nice friends you have.
Yeah. They're lovely, yeah.
Right, what an introduction, everybody that's tuned in to hear about. Yes, we are. Welcome back, everybody. Hope you've had a good week. You'll see that I've got the devilish duo with me again, Will Murphy, Carl Horton. How are you, gentlemen?
Very good, thank you.
Yeah, good, thanks.
Fantastic. Can you believe we are in the last week of February already? Where's that gone?
Who knows? Flown by.
Flown by. Right, gentlemen, come on, let's have a little debrief. Will Murphy, how's your week been?
Same sort of dental mania going on, just pretty relentless, which is good. I did a bit of mentoring down in Devon on Tuesday, so I've been racking up the miles. So one of my old cohort from the FGDP diploma was putting some implants in, and she did exceptionally well. Well done, Danielle. Yay. So, I didn't really need to be there. I was just there taking photos, to be honest, and trying to chip in when I could, but wasn't really needed. So, a lot of driving, but it was good. It was nice to see someone who hadn't placed many implants before looking very competent, and to a point where you just go, "You don't need me. Just go fly, go do your thing." Leave the nest. Yes, go do it. So that was great. Yeah, very, very satisfying to see that.
Yeah.
And again, just sort of taking in the news that, are we leaving lockdown and all that sort of stuff. Booked a holiday. Woo.
How cheeky.
I know. I just thought, quick, do it. So, going to do a bit of British staycation in Cornwall in August.
St. Ives.
How can you know that? That's amazing. You have powers. Amazing powers. Ooh, look into my eyes. So, yes, we might have had a phone call during the week. So, possibly.
Yes, for anybody out there, they have been speaking in the week.
So, and then today is my daughter's birthday. Happy birthday, Chloe, 23.
Happy birthday, Chloe.
Yeah. So, yes, I'll need to check in with her a little bit later, do a bit of an old Zoom call and wish her all the best because she's down in Biarritz. So,
is she going to be in a similar condition as the last offsprings? was when they had their birthday?
No, she won't. No, I think she's graduated from the 18-year-old drink everything that's put in front of you routine. Not that she hasn't done it, but I think she's learned a lesson. She's the rocker sense of the family. So
right,
I would imagine she's probably being very sensible.
In Biarritz, did you say?
In Biarritz, yeah. She was acting as a nanny there. She had a job. She's quite into learning French and speaking French, and so she invests a lot of time.
Is that like Mrs. Doubtfire when you say acting as a nanny? Kind of like, or was she actually a nanny?
She was actually acting as a real nanny, I think. Yeah.
Okay.
I mean, I don't think she's got any qualifications, but there you go.
Yeah.
So she's doing that, but she's got a real proper job. Not that isn't a proper job, but she's got a career type job in London in July, all being well.
Excellent.
Fantastic.
And what's that?
Can we ask what doing?
She's working for JP Morgan, so she's going into the heady world of finance in the city.
Wow.
So hopefully she will look after her old man. Get me a sea view. I said, Chloe, just a sea view, that'll do me. I'll be very happy with that. So there you go, no pressure. So that's my week. Yeah, good, lovely.
Wow.
Is that what you were doing in Devon? You were taking pictures of the sea views and saying, I want something like this. Not the implants.
I was sort of sizing up these sort of coastal houses, with terraces and verandas, and just going, that one.
Nice.
That one. One day.
Fantastic. What about you, Cole Horton? How's your week been?
Do you know, I have to think when you ask, because it starts to, probably the same as everybody, it kind of just merges into this kind of, and I hate to say it because it's not bland, but it's kind of just, everything gets mushy. Maybe that's just old age. But we did the webinar last night, which is
good.
That's going well, and I enjoyed that. It's the article review webinar where we pick an article each with Sinjan, Fadi, Manaj, Will. If you're interested, there's a space.
I might stick my head in one day. What were you reviewing?
I was doing Cholhexidine, pre-procedural Cholhexidine mouthwash, and whether it was effective in reducing problems with implants, problems with periosurgery, and surgically extracted teeth. And it was, they ended up with 35 papers in the study. And they didn't have many on perio and many on implant. I think they were 1 implants, 4 on perio, and the rest were on extraction sockets. And the main findings were that they had a reduction in the incidence of dry socket if the patient rinsed with Cholhexidine prior to it. And I know your views on Cholhexidine as well. And we had a good discussion around that, and it was good discussion, wasn't it? And Sinjan kind of piped up with because I was talking about whether we do it for patients that have implant surgery and whether it's beneficial, and the fact that it's kind of washed out the mouth and started getting onto AGPs and all this sort of stuff. Sorry, he's just murdering his friends online. And I used to do it with American kids. Still do. And, Call of Duty. God,
take them down.
Where was I? Oh, and he was saying that because of the reduction in bacteremia, which this paper actually showed as well, or the papers they researched showed that certainly occurs, and they deselected patients that had antibiotics as a pre-procedural technique. So if you just have the Cholhexidine mouthwash, that the incidence of bacteremia is also reduced just by having Cholhexidine. And Sinjan was saying that actually, with his age and his concerns now, he's actually using that before he brushes his teeth to reduce the bacteremia, which I thought was quite an interesting comment.
Okay,
it's not something that I think it may have occurred to me in a small, but not to that extent. I thought it was quite an interesting. So we had an interesting conversation about that.
Was there a control group with Scotch whiskey? Can we get Jag to provide the randomised control?
Yeah. Well, that was kind of how effective Listerine was, wasn't it? But not quite as enjoyable. So it's just the alcohol content in the old list. Got to get it right because just in case they're listening.
In case about to sue you for all your worth.
So it had quite a good alcohol content. And then they put what did they put in it? Oh crikey, it's gone out of my head.
Who's that? Listerine.
Yeah, the plant-based. I can't remember. It's gone out of my head now. Oils, essential oils, didn't they? They put essential oils in it. Which St. John again was coming back to with the peppermint oil and chlorhexidine because somebody mentioned about the allergy. Manoj mentioned about the allergies, and it was interesting that St. John said, "Well, is it the chlorhexidine that is the allergy, or is it the peppermint oil that's in Corsadil?" Because it's most of these issues have been related to Corsadil, and these guys had looked at. It's like I'm repeating the paper, Kate. These guys had looked at all sorts of things. So they'd looked at basically just chlorhexidine. They hadn't looked at a brand. They'd looked at different doses, 0.2, 0.16%. The gels, the rinses, in the papers that they'd looked at. So yeah, some of them were split studies. So it's quite a good paper. It's quite it's brought up some interesting conversations.
And have you drawn a conclusion that will affect your practice?
Well, that's what I was kind of debating really, and that was the problem, is that I don't really do surgical extractions. I'm really just placing implants. But I think if I was doing surgical extractions, then I'd probably think, well, we're going to use a chlorhexidine mouth rinse. I mean, the incidence of dry sockets, well, they reported it as 3%. St. John reports it more as like 5%. So, it was an Italian paper, so it might just be that the papers that they'd read showed it slightly lower. But I imagine it is probably more like 5%. Certainly in my experience, I think.
Yeah, I think so. Certainly in lower molars, where I'm trying to do bone preservation techniques. So I'm kind of trying not to raise a flap, or I'm just reducing, taking out a bit of furcation bone.
Yeah.
And then, being a little bit more patient and using periotomes and things. I do find people probably are going to get a bit more risk of dry socket. Now, whether that's because I'm pushing and shoving for a bit longer rather than reaching for the scalpel and, hacking all the bone away, where I probably find I get less dry socket, maybe a bit of more post-operative discomfort because you've raised the flap and taken some bone. But probably not as much dry socket as I get from, those lower 6s and 7s and things like that.
Yeah, I made a fatal mistake when I was an associate, and the other associate just joined the practice, really eager young lady, and she said, do you get many dry sockets? No, I think I'd had one in about 5 years. I think I'd had one, and then I got 3 in a row.
Hat trick.
Yeah, bing, like that.
Bing.
Yeah,
but it happens, doesn't it? It's kind of the way it is, and it's also one of those things where the patient comes in, probably following on from your topic of last night, probably wanting antibiotics, which probably just isn't the thing to give for a dry socket. So, I usually find myself trying to explain what bone inflammation and healing is, but and you can see why sometimes dentists probably do just think, just give antibiotics and it's all done with, Whereas you're just having to say, well, you've got to tough it out, haven't you? It's that's just the way it is.
It
sounds brutal, but that's the reality.
It is.
That's Phil Murphy, everybody.
I don't actually use the phrase "tough it out." Love.
Tough it out.
Yeah,
it can be
good bedside manner. That
it can be quite nasty pain. I've heard.
Yeah, I think it hurts.
And thankfully, I've not again had much incidence of patients reporting it to me. Anyway, they probably just don't want to tell me. Probably because I get the same response as you just said. Tough it out. But when I remember one poor chap, and he was in discomfort, not huge amount of discomfort, but at first he was, but then when it settled, and I ended up referring him off because this discomfort just didn't disappear after about 4 weeks, and the oral surgeon chap just said, it's one of these things. It happens, and it may be 6 months that he's going to be in a bit of discomfort for. And thankfully it wasn't quite that long, but it was quite a while that he grumbled for, and there was nothing spectacularly different about taking the tooth out. And yeah, it was just straightforward, simple extraction, and he just got dry socket.
Yeah, so he really did tough it out.
Yeah, yeah. Well, like Will said, giving them antibiotics is not going to touch it. It's not going to get to where it needs to get to, and the bone really is just got to repair. So going in there and kind of aggravating the bone can just make it worse, and you're putting them through more pain. And it is difficult to get them numb. And then you've got to clean that bone out. And I mean, even talking about it sounds sore. So, putting somebody through it, it just doesn't work. So what you have to do is let the bone repair. And usually, over, 99.99% of the time.
Isn't this the good thing about what we do, is that for all the trauma we do in the mouth, it just wants to heal, and it heals well, doesn't it? You just have to let it get on with it. And it generally will, by and large. So,
do you find yourself? I think you just touched upon it, Will, that you probably spend not a large proportion of your time, but more time explaining why they don't need antibiotics. Than actually, because of that mindset. A patient might just think, "Oh, it hurt. Right, I need antibiotics."
Yeah, and it probably goes back to, I don't know, again, I'm probably drawing huge conclusions without any evidence, but maybe the old system where we used to have a lot of patients coming in and we probably wanted to get the patients out again fairly quickly. Yeah. So it may well have been an easy out, just to hand over a prescription for some Amox and say, yeah, it hurts, because they'll say, oh, I've got an infection, Whereas, now in my old age again, I probably just will sit there and, say, be a bit pedantic about the whole thing and say, well, you haven't got an infection, you've got bone inflammation, and I can give you antibiotics, same old chat we all do, but you may need them for something much more serious in the future. So, that tends to be my take on it now. And sometimes people are a bit upset because they are expecting to be given antibiotics because that's going to make it better.
Yeah.
So
I think the Scottish guidelines are excellent. Actually, I think they are absolutely superb. I think they've evidence based them and drawn them up. And I think if you're not familiar with them, anybody that's listening that's into, even if you're not a dentist, just
look
go
them up anyway.
Yeah, just look them up anyway. I think that they've done a superb job of kind of explaining, when they should be. In fact, I think they've actually got kind of like a little online CPD thing that you can do, that you kind of click the boxes as to the scenarios they give you, and then it tells you how good you are at your job.
About this than me, but certainly from the Scottish side of things, they do some quite nice things. I've seen some on anticoagulants as well. Sort of outlining the newer anticoagulants that can be a little bit tricky, that more people seem to be on these days, which probably leads me through to another thing about the rivaroxabans and the apixabans and things like that, where from all the research I can see, the jury's still out about drug holidays.
I thought you were going somewhere else with the Scottish side of things, and I thought you were going to start talking about how they can backstab politically.
Talk about the crankies.
You know what? That's fantastic.
Yeah. Well, I think there's fireworks up there. But anyway, I don't know if you've got any regime for people coming in, or how you tend to deal with these sorts of things.
I don't like see you, Kate.
Kate with border.
Yeah. I don't like I say I don't like drug holidays are something that I steer away from.
It's not a Madonna song, so before you start singing.
But obviously,
very impressive. You know that well.
Look, I'm from the 80s.
Have you done as a Madonna fan?
I'm from the 80s. I know them all. Before I get my two cones out, I think Carl better carry on.
I thought Drug Holidays wasn't it XTC?
Fabulous.
Or something like that. Or was that Dreadlock Holidays?
Oh no, Holiday.
No,
definitely from Madonna.
Yeah. Anyway, yeah. So
sorry, Carl.
Yeah, no. No, it's fine. I think you're far more entertaining
seamlessly going between anticoagulants and 80s hits
with cones.
with cones.
Just how we roll.
Like cricket.
We were doing really well.
Give me an idea for next week.
I love it. So yeah, just a bit longer, basically. I just keep them in the chair until I'm happy that they've stopped oozing.
They're not going to bleed out on the way home.
Yeah. And again, an important point is that we'll follow up as well. So we'll do a follow up maybe in the evening and maybe the day after, just to check that everything's okay. And probably a little bit more, not that you're not rigorous, but a little bit more, enforcing. Look, if you get any issues, don't just forget it. Give us a call. And this. So with those patients, we're more on high alert. But we were on high alert with all of them after work. But it's probably less intensive, I should imagine, because of those patients that we don't know about. So it's the same precautions for all of them, I guess. Really, I mean, before they leave the room, you just make sure they're not going to be spitting blood everywhere, don't you? Really, otherwise, someone's got to clean it up.
Kate, bring a mop.
Mrs. Mop, yeah. So, Will, how's your Fridays going? Have you managed to keep your diary free?
At the moment, no. I think they're kicking in next month because I had to. I had to find the first one that was not booked. You see, so that had to stretch into March. So I've got those eyed up in the future. So I'm just going to be, just having time to either do a bit of exercise, do a bit of cycling.
Don't rely on Joe Wicks.
Bit of Joe Wicks.
Wow, I was all excited this morning. So I was all ready at 9 o'clock for me, Joe Wicks workout with Seb. To be fair, he was late. However, we did do a workout, but it didn't happen. And I thought I was being old and, I can't work the internet. And, it turned out his Wi-Fi didn't work. So there was no live Joe Wicks. Yeah, no live Joe Wicks this morning. So there's
happens to the best of us.
Yeah, no bunny hops.
Well, quite a lot happens to Joe Wicks, doesn't it? I mean, to be fair, his Wi-Fi goes down. Farts live on air in front of thousands of people. But fair play to him. He took it on the chin. So so to speak.
Well,
so did you run instead?
Good to know that other people's batteries run out.
Both. So we did, right, there's a method to his madness. So we did Joe Wicks, and then he said, I fancy going for a run, Dad. Can we do a K? So he does this little 1K run, and he's getting a little bit quick for my liking, if I'm honest. I can feel my heart kind of twinging a bit.
New generation.
So taking a little GTN just before we start.
Okay.
Anyway, and it's probably to go faster. And then when we got in, he said, oh, can we do another little run? So and it kind of penny drops, homeschooling. So he's delaying the inevitable for as long as he possibly can.
Do you think he knows? Right. Do you think in his mind he's thinking, "I've got you"?
Well, because I know I've got to be a little bit quiet because Kelly don't watch these. I don't think we'll find out. We'll find out when we. Is that what he then did? Is he said, "Dad, I'm going to go upstairs on my phone, tell Mom I'm outside in the garden exercising." And I'm like, right. So I went upstairs. And he's on the bed going like this. So I walked past Kelly, who's on her laptop doing a coursework. She goes, "Where's Seb?" I said, "He told me that he's outside in the garden." I didn't say so. He told me that he's outside in the garden, which is the truth because that's what he told me.
That's what he told me.
Yeah. Little sneaky so.
I think I'd have to go for the EPO. Yeah. Steroids.
Yeah.
Shot of coffee.
Yeah. Is that for him or me?
That's for you. You're gonna have to raise the game.
You're telling me, mate. Telling me. It's getting hard work. I'm getting old.
Listen, I've given up the ghost. Used to be once upon a time. You'd arm wrestle the boys, and then you'd kind of let them win. And then one day I'm like,
We went to I think it was Helen's one of the girls that I used to work with, a lovely lady. we went to one of her house parties. It was either hers or Annabelle's, and I took Luke and Seb, and there were these big weightlifting lads that were kind of hanging around. They were in the conservatory, and Seb had disappeared off for a good 20 minutes or so, and then he come back and he went, Dad, come on, show me how strong you are. And I'm like, what? He went, show me how strong you are. I've been arm wrestling them. So I walk in, and these guys are like about 6 foot tall and about 6 foot wide. They got biceps like this. And fair play to the bloke, fair play. He sat down and he just went like that. So I put my arm against him, and bless him, he let me win in front of Seb. Like, gave me a little bit, but he just winked at me and let me win. And Seb's like, whoa, look how strong my dad is. Like this.
Just pass that 20 quid across the table.
Yeah. Cost me a fortune. Cost me an absolute fortune.
Thanks, mate.
We'll sort your implants out if ever you need any.
You're still the hero. I know. It's just that day when suddenly they realise that they can trash you in arm wrestling and running. You're like, game's over.
Game is over. It's not going to be long. It's not going to be long.
Well, gentlemen, we've exceeded that magical time.
No way.
So
That's
I am calling last orders on this webinar this evening.
Excellent.
Last orders.
I haven't even told you what. I only told you one part of it. I haven't even got started yet. But I'll save it.
Save it. Keep those golden nuggets for next time. Little cliffhanger for anybody out there.
Gentlemen, thank you very, very much for your time this evening. Everybody out there, hope you have a lovely weekend and a good start to March. Have a good evening, everyone.
Yeah, enjoy the moon.
See ya.
Take care.
Take care. Bye-bye.
Bye.